We're now going to look at the anatomy issues in relation to head, neck and spinal injuries from ligature events. So one of the things we need to understand are some of the systems within the head and neck, so such as the nervous system, as well as the bones and everything else that's there. And this is quite handy knowledge to know about the anatomy, not just from the ligature event, but then how we handle the casualty when we take them down and the immediate first aid that we provide until the healthcare professionals arrive. Now, when we look at the anatomy of the body, the skull comprises the cranium and the mandible. Now we're going to whiz through some of these slides, so I'd encourage you to read them over again and look at the issues around. The cranium is made up of 20 bones and then the 7 vertebrae in the neck. The first vertebrae is called the atlas and the second is called the axis. There's then a large hole in the base of the skull, which is the foramen, and it allows the brainstem to become the spinal cord. Now then when we look at the nerves, there's 12 sets of cranial nerves, and the cranial nerves pass through the skull from the brain. The functions vary, but the main functions include muscle control, helping the brain interpret the 5 senses, and controlling glands in the human body. Each cranial nerve pair controls specific functions of the human body. So it's a real vital conduit, the neck, passing all of the control mechanisms. And I like to think of the brain as being your laptop, in effect, your hard drive, and all of the wires are going through the neck to the rest of the body. So if we damage anything within the neck, this is why then disabilities can occur as well. Now, cranial nerves can be damaged by injuries, such as from an asphyxiation event, tumours, inflammation, infections, inadequate blood supply, drugs, and other toxins. The different functions then of the nerves, you can read those at your leisure, but they affect the likes of your smell, your sight movements, eye movement, sensation, eyeball movement, facial movement, your hearing, your spatial awareness. So even if a person survives a ligature event, they can still suffer from serious disabilities and lifelong changes because of the ligature event that occurred. Now, the 10th cranial nerve is the vagus nerve, and this runs between the carotid artery and the internal jugular vein. And this is quite an important nerve to know about from ligature events, but also from the likes of the use of force and the immediate first aid that might be offered as well. The vagus nerve is the longest and most complex nerve, running from the brain to the thorax to the abdomen. Now, the vagus nerve transmits messages to the respiratory system and the cardiac system. So it controls involuntary movement in the esophagus, the stomach, the gallbladder, the pancreas, and the small intestine. The esophagus connects the throat to the stomach, running behind the windpipe and the heart. Stimulation of the vagus nerve can slow the heart rate and cause cardiac arrest and death. And this is why, for example, neck holds during restraints can cause people to pass out. But the ligature is actually forming that compression on the neck, and that in itself can stimulate the vagus nerve and can slow the heart rate and cause cardiac arrest and death quite quickly. Neck restraints should always be avoided, and concerning ligatures to the neck, any pressure to the part of the neck increases the risk of injury and death. And when we think about what's in the neck, we've got the cervical vertebrae and discs, we've got the spinal cord, the windpipe, the voice box, the Adam's apple, the carotid arteries, the carotid sinus, the vagus nerve, and the jugular veins. Now, any pressure to the mandibular angle risks pressure being applied to the carotid artery or the vagus nerve. Pressure to the vagus nerve may slow the heart rate and lower the blood pressure, and pressure to the carotid artery may reduce blood flow to the brain, and damage to facial nerves may also be caused. Now, just as an aside, the mandibular angle pressure point is often taught within the likes of the police and prison sectors with use of force and some martial arts. So it can be a very dangerous area to put any pressure to. Now, the 12th cranial nerve is the motor function nerve, and it controls the tongue movement for speech and swallowing, and damage to the nerve can impede tongue movement. It travels close to the vagus nerve and it passes between the carotid artery and the jugular vein. The brachial plexus pressure and striking point This is a target area which is in the neck as well. And again, it's used for a use of force, but it can be damaged or compressed during a ligature event. And it's a network of nerves that send signal from the spinal cord to the shoulder, arm and hand, and it extends to the clavicle or the collarbone. The suprascapular nerve and artery, this is found within the neck. The artery is found within the neck, and the nerve supplies the shoulder muscles. The suprascapular nerve rises from the upper trunk of the brachial plexus, and it receives nerve fibers from C5 and C6 cervical nerve roots. And this then passes underneath the trapezius muscle. Now, thinking about the spinal cord, which is within the torso and also within the neck there. So here we've got a picture of the spine. So let's have a look at some of the issues around here. So we've got the spinal cord, which is carrying all the nerves. We've also got the vertebrae, the vertebral discs, the vertebral vein, and the vertebral artery. The spinal cord is about 18 inches long and as thick as a thumb. The spinal cord is surrounded with a membrane called meninges. Now, the spinal cord runs within the spinal canal, and the space around the spinal cord is greater in the neck than it is in the thoracic area, which is the mid-back. Injury in the lower area is therefore a greater risk from trauma impact. Ligature events, or taking a person to the floor, or the person falling to the floor, can create trauma impact. So this is why we need to be careful when we're handling the person during the cut down. Spinal shock is a state of complete loss of motor function, and there's a possibility of sensory function loss. And this can be caused through the likes of falls. Thinking about people as well, older people, or especially older women, when bone density is being affected, especially through menopause and after menopause, a woman's bone density significantly changes to that of a man. Injury occurs most frequently at the junctions of the mobile and fixed sections of the spine, for example, where the cervical and thoracic spine meet, which is C5, C6, C7, and T1 area. Spinal cord injury may prove immediately fatal where the upper cervical cord is damaged, paralyzing the diaphragm and respiratory muscles. So this is why when we're cutting the person down, we need to try and stabilize the person and take the weight before we actually do the cut. So it needs to be practiced within teams in order to get it proficient. So it's not just about cutting the rope and letting the person fall. We need to manage the whole thing from the cut down, the securing of the person and taking to the floor, and then dealing with the life-saving issues there. Now, we've also got to think about vomiting and aspiration, because they can be serious consequences of a ligature event as well. Patients with a head injury may have a raised intracranial pressure. So again, when we're taking the person down, we've got to be balancing potential head injuries with spinal injuries and other damage within the neck and head area as well. Now, the hyoid bone, which is the lingual bone, or commonly called the tongue bone, it's a horseshoe-shaped bone situated in the anterior midline of the neck between the chin and the thyroid cartilage. At rest, it lies at the level of the base of the mandible in the front and third cervical vertebrae, so C3. The hyoid bone fracture is usually the result of a direct fracture to the neck because of manual strangulation, hanging, blunt trauma, or projectiles. This is a possible injury from a ligature event. And although rarer, it's possible during a use of force process to damage this bone, especially if neck restraints are applied. Now, casualty management during and post cut down is critical, which is why we're going to go on to the videos in relation to how to cut the person down, how to manage them to the floor, and then how to manage them when they're actually on the floor.